Regardless of the reconstruction that's performed, for the first few weeks after the reconstruction, it is really essential for patients to have support at home, both for their physical and emotional needs. Initially, activity and the arm range of motion restrictions will be placed that are gradually lifted through the first month after surgery. Good morning. It's so nice to see you.
Yeah.
How are you feeling after your surgery?
I feel fine. A little pain, but other than that, I feel fine.
Yes, so your drains are gone, so that's amazing.
Yes.
Finally. And how much are you doing as far as activity now?
Really, I'm not doing anything except for just getting up, walking around, following your directions. Arm range movement, still at my waist, but nothing too strenuous.
Let's take a little peek and see. So traditionally, patients have their arm use slightly decrease the first 2 weeks after surgery, but after that, gradually, they can resume using their arm in normal daily activities. And at 1 month can go back to a desk job, and at 6 weeks, usually back to a more active job. A little bit higher, maybe in 2 weeks, you can start doing the circles.
Okay.
On the wall. We just want to make sure that your range of motion is good. But now, the drains are out, so presumably everything's healed. We're not as concerned about the fluid as much as we were, so that's why we can increase your activity. And now you can start driving. That is actually great news, which means that the nerve is starting to grow.
Okay.
Basically, with the mastectomy, the nerve is cut because it goes through that breast tissue. And so that nerve can grow, and it can grow back into the mastectomy skin. And as that nerve is growing, it will have kind of a feeling of pins and needles, kind of it could be even kind of an electric shock kind of feeling. And that's actually a sign that the nerve is growing. And the nerve grows about 1 millimeter a day. So within about 6 months, it'll reach its target, and that discomfort will subside. So there is a bit of swelling, which contributes to the breast feeling heavier. We will look at things at about 6 weeks, like I mentioned on that appointment, and we'll see if we need any post-mastectomy lymphatic massage. And that will help with decreasing any swelling to kind of move some of that fluid around, and that will help that heavy feeling as well. So next time we'll see you is 6 weeks post-surgery. So this is your 2-week appointment. Then we have 6 weeks after surgery, and then 3 months. And at that point, we actually do a consultation to review the symmetry. So we'll sit down and this is the point where everything's already healed. Mm-hmm. And so we look and see if you're happy, if you feel like you need any symmetry revision procedures, and that's kind of our overview. And then at 3 months, you're actually able to go back to normal activity completely. So any exercise, all of that. At 2 months, you can start doing a little bit of that. And at 3 months, you're back to where you were before surgery. Little early to do that now. You can, as you're moving your arm, you can start to sort of do that sweeping motion to sweep the lymphatic fluid up to the armpit, kind of the axilla area. But if we feel like there's a lot of fluid that's stuck there, we may actually do a formal physical therapy consultation. At Houston Methodist, we really specialize in the most advanced state-of-the-art breast reconstruction. We actually have a lot of patients coming in from around the country to have specialized procedures here, including advanced microsurgical procedures, resensation procedures, as well as direct-to-implant reconstruction, which was actually developed here in Houston.